Has your mild knee soreness already worsened to more significant aching pain and stiffness? Or have you restricted your ability to squat, train, or even do what you used to love doing because of your bad knees? Then stick around so that I can show you better ways to train your knees. Knee pain can not only be debilitating and annoying, but also frustrating because most exercises aimed at relieving your knee symptoms actually worsen your knee pain. While there can be many causes of knee pain, we are going to focus our intent on the management and treatment of mechanical knee pain, which you may have been told is a result of arthritic changes, degenerative changes, bone on bone, sprains or strains, meniscal damage, cartilage damage, ligament damage. All of these can be effectively managed using the following strategies. Now, before getting into the more active exercise principles, let me show you a few quick ways that you can easily reduce your painful knee symptoms. So for our first knee stretch, we're going to sit at the end of our chair, place our leg out with our heel resting on the ground. Your leg is going to remain relatively relaxed. You're going to take your hands above your knee and press down to the floor and let off. The purpose of the stretch is to essentially straighten the knee and even hyperextend it slightly at the knee. You're going to go on, off for repetitions. At full speed, it should look something like this. On, off. On, off. Remember, your legs are relatively relaxed during this. No muscle activity is occurring. The whole stretch is taking place because of the pressure from your hands pushing down and letting off. So the second knee stretch that we're going to attempt is very similar to the first one, except it is a more active form of the stretch, meaning you're not actually using your hands to perform the stretch. Rather, you're using your own leg and knee muscles. So what you're going to do is sit at the end of the chair again. You're going to extend your leg outward with your heel on the ground, and rather than actively pushing the knee down into the floor, you're going to use your own leg muscles to straighten the knee, contracting the knee muscles into straightening, hold for at least 6 to 8 seconds, and then relax. You're going to perform this for repetition. So again, we're going to press the leg down using these knee muscles to straighten the knee. You're going to hold for at least 6 to 8 seconds before you let up and relax. One final note is you will also be pushing the heel down into the ground too as you perform the stretch and use the pressure of the leg muscles to push and straighten the knee into the ground. So one more time, going from a relaxed position of the knee to full straightening. You're pressing the heel into the ground as well as the knee directly into the ground using your own leg muscles. My general recommendation for these knee stretches would be to perform them for one set of 10 to 15 reps 3 to 4 times throughout your day. Obviously, the more consistent or frequent your symptoms are, the more consistent and frequent you can perform these stretches. And now that you have significantly reduced your knee pain, let's discuss a few key exercise principles that will help you to safely and effectively train your knee. One fundamental principle to understand when attempting to effectively train your knee is to not perform exercises that simply isolate knee movement, but rather train stabilization of the entire lower quarter, which includes not only your knee, but also your foot, ankle, hip, and pelvis. Taking this new perspective into account, we want the majority of your knee exercises to consist of movements where your foot is on the ground the entire time. Exercises like squats, lunges, and split squats are a perfect example for the type of training we're suggesting. Finally, there are some characteristics regarding the posture of your lower quarter that you should apply to all of your knee training exercises. Looking at it from the ground up, the placement of your feet should be a little bit wider than shoulder width apart and just slightly turned outwards. As far as your knees themselves go, when observing from the front, as you squat down, you don't want to see your knees cave inward. Also from the side, as you squat down, you don't want to see the knees track outward far in front of your toes. As far as your hips, your pelvis, and your low back goes, as you squat down, you are effectively sitting backwards into your hips as if you're sitting down into a chair. Your low back should remain relatively straight and neutral throughout the entire squat. It's neither hyperextending or arching, and it's not slumping either. Okay, so now that we understand the key principles for effective knee or lower quarter training exercises, let's see how they apply to a specific exercise like the body weight squat. So for our final knee exercise, we're going to go over the fundamentals of a squat pattern. This is very important to understand the normal postural alignment of the entire lower quarter when we're performing any type of squat or knee exercise. So from the ground up, when we're performing a squat, we want to make sure our feet are a little bit more than shoulder width apart and our feet are just slightly turned outwards. No plie ballerina with our feet out to the side, but just slightly turned outwards. Going up to our actual knees, we want to make sure that as we lower ourselves to the ground, our knees are never caving inward. In fact, they're going to be going outward straight over our second toe. Now, if you were to look from the side as you squat down, you never want to see the knees go far out in front of the toes. They want to stay relatively over the feet and over the toes. Now, if I turn to the side, as we squat down and work our way up to our hips and our low back, you want your low back to remain relatively neutral the entire time, or relatively straight. The entire movement is going to be coming primarily from your hips and your knees. So as you squat down or lower to the floor, you're going to be sitting back through your butt towards the back as you squat down with your knees and come back up. Notice my upper body stays relatively relaxed. My head and neck are relatively neutral. My hands can reach to the floor because particularly you're going to be attempting to pick things up from the floor, so you want to reach the floor. My eyes, in fact, actually look down to the floor a little bit as I squat down. So once again from the side, you see that I'm sitting back with my butt as I bend through my knees and look to the floor. And then I come right back up. Again, if I look from the front, our feet are a little bit more than shoulder width apart, just slightly turned out. We're making sure that our knees track wide and over our feet as we sit back into the squat and come back up tall. This is the normal type of squat pattern that we'd like to see with any supporting exercise for your knee. One final piece of advice. If your knee pain actually worsens as a result of using these particular stretches or exercises, then I suggest giving it a little break and time to calm down. If they persist, then I suggest using ice or heat to try to decrease the pain because these stretches may just not be for you. Now, if you have been experiencing significant knee pain and would like a professional evaluation and treatment that comes directly to your home or place of business, then click the link below to schedule your appointment with me now, and I'll see you soon.